Hello, this is Amy Gleason, and today I'm going to tell you about how CareSync solves the four main barriers to patient engagement. But first, let me show you around a little. So today I'm logged in as Lucy Carter, and as Lucy, I'm the mom to this family. So these are all the people who I can help manage their health. Up here at the top, you see we're looking at Sean, who is Lucy's asthmatic son. On the right side of the screen, you can see all the other people who help care for Sean, people like other family members, the school nurse, and the CareSync Plus service. In this activity area, it's kind of like a Facebook feed, but for your healthcare information, so that everyone who has access to Sean's information can keep track of what's going on. In the middle here, you can see Sean's day. This tells him the medications to take, the appointments that are here for today, and any tasks that need to be completed. So CareSync is available as a free application on the web and in the mobile devices. So that's available for anyone who wants to enter their own information into the system. But we also have the CareSync Plus service. The CareSync Plus service allows us to be your health assistant and help you manage your health. So here you can see the three main steps. First, you request records, then you add family and caregivers, and then you manage visits. So first, I'll click on Request Records. So we have a database of providers that you can easily search for and find your doctor, so it already has all of their information. So here I'm going to request a record for one that's here, and you can pick how far you'd like to go back in getting your records, which records you'd like to receive, and then say Next. This brings up the Hipaa authorization form, and as Sean's mom, I can sign Lucy Carter, my signature, and say I'm the parent of Sean, and then I can say Next. Now at this point, our CareSync team goes off and gets all of Sean's records from that provider. So the first thing that we do is we get the documents themselves. So we get documents in a variety of ways. We get some that arrive in the mail, some that come by fax, some that come electronically as standard documents like a CCD format. We get others in CDs. Pretty much any way that we can get them, we take them, and we put them first step here in the documents section. So most patients have never really seen their information, so that's the first barrier, is really access. It's just difficult for patients to get this information. So for the first time, many of them can see the information, like looking at this office visit note, for example. So now they have this information and they can review it and see if they find any errors. So over a third of our CareSync Plus members so far have found an error in their medical records. So having all of this information is a really big boost, just having access. But it's just really the beginning. So most patients really get that information and it's helpful and they can read it and it's a good start. But it doesn't really help them become more engaged in their health. So the next barrier is meaningful. So we start to make this information meaningful. This is a high-level dashboard here. You can see where we really take the information up a level, and you can see recent changes that have happened underneath each category. So this is now also shareable, and I'll get into that a little bit later, but all of our information is shareable with all of your providers. So from here, I can click into something like health conditions, and you can see all of the health conditions that Sean's had in the past. Now, CareSync Plus enters in all of the current ones as well as all of the past conditions using standardized terminology. And we start to really link all this data together. So medications that you take for conditions, the provider that you see, as well as any notes and dates that are related. So all of these things are entered using a standardized database. So you can see if I start to type, you can get all these different things from a database. And these are all standardized so that if the patient were to enter in high blood pressure, and the provider said hypertension, we know that those are really the same thing on the back end, so we can link it all up together. So once we do all of this, that's really great, and we give you a shareable piece of information. But the really great thing that we do after that is we go through all of your history and create a medical timeline. So here you can see are all the visits that Sean's had in the past. So we create that information and put a summary of what happened for each one. So let me show you an example. I can click on more of any of these. So here's a summary of the visit and any relevant information, the related health conditions, related medications, any notes and tasks, as well as the actual documents that came out of that visit. So this is great for the member to be able to view their timeline and really understand what's going on, but it's also filterable. So you have filters for date range, provider, appointment type, health condition, and even medication. So once you filter this type of information, you can also share it as well. So if I click on View and Share, then I can get this great report that has personal info and allergies, providers, along with their specialty and phone numbers, health conditions, medications, and then also these summaries of the visits. So what's really great example is people like to share just the visits that have happened since the last time they saw their provider. So the day before the visit, you can send over your current information as well as all the summary of what's happened since the last time you saw them, so that by the time you see the doctor, they're already caught up on everything that's happened, and then they can really focus in on what you're there for that day. So our next barrier is collaboration. So all of this information that you're seeing is also available to anyone that you share. So just like in Facebook, you can share pictures or timeline events. In CareSync, you can choose whether you share medications or documents or appointments. So the family members that you share with here, you can come in and also collaborate around these. So family members can share information before the visit. So if you have an elderly parent or a child, then maybe a child of the parent or the parent of a child can also share that information on their behalf. Similarly, we have tasking and commenting as an example. So maybe Sean is having a little problem because he's creeped up in his diet and needs to lose a little weight. So they're kind of trying to get him to exercise and eat a little bit better. Then the mom can give him some encouragement as well. So you can collaborate around these tasks, whether it's somebody that's going to drive somebody to an appointment or give encouragement, somebody's going through chemotherapy or radiation or just trying to do a better job with their diet. So this gets into the collaboration piece. So by sharing from that health summary and from anywhere else in the application where you can share with providers or anyone that you want to share with, as well as anybody you've given access to your CareSync account. So now I want to get back to the My Day concept a little bit. So what we do when we get all this information is not just key it in and get it all into standard terminology, and that's all really great, but we also synthesize that information. So we've found that if you get medication lists from 4 different doctors, that they often have 4 different medication lists. So we work with the patient to figure out what they're actually taking, and we get that into the system and then provide reminders. So now not only can Sean get reminders on his iPhone or iPad or iPod if he has one, but also the family members can as well. Or the family members can just choose to get alerts if Sean doesn't take his medication. This also allows you to track as needed medication. So Sean's an asthmatic and he can track how often he's using his rescue inhaler, for example. So all of this collaboration really gets the family to help rally around the patient. The next thing is collaborating before a visit. So before a visit, the family members can also come in and put any information in about what they'd like to get out of the visit. And this information can also be sent over to the doctor the day before the visit, so they kind of have an idea of what the agenda is before that visit. So this brings me to our last barrier, which is convenience. So we do convenience things like requesting appointments. So you can come in and request an appointment and pick what you're going to see the doctor for, the dates and times, and whether you're a new patient in the specialty. And then CareSync makes that appointment for you. We also do cancellation, reschedules, and all of that kind of information as well. So we try to make it really easy for members to go to the doctor. The next thing is that our application is all available on the mobile device. So today's world, people always have a mobile device with them, and it's important to be able to take your health information with you as well. So I'm going to show you what this looks like on the mobile device. So first of all, I want to show you the My Day concept. So right from here on the mobile device, you can get push notifications that alert you that it's time to take your medication. And then you can just come in and document whether you took that medication on time or late. Or if you missed it, you can pick the reason that you missed it as well. So maybe I ran out of that medication. So you can come in and document all of that information. You can also add any as-needed meds like Advil or Tums or pain medication. So it's really great to track how often you're using those, and you can use that also to tell your story. I also have quick access to my appointment from here. So here's my notes that I need to review before the visit. And then I can even come in and do things like voice record. So this is one of our most popular features. We've had over 80% of our members tell them that voice recording and our follow-up tasks that our CareSync Plus service gives them have helped them to remember some information that they would have otherwise forgotten from the visit. So I can just touch on that microphone icon, record what the provider is telling me from the plan and any discussion that we have. And then not only can I listen to that when we get home and any time in the future, but so can any other family members who are helping with the care. So this is really great for if you have a relative that lives out of town, maybe your parents live in another state. You can have them voice record it, and then you can hear the doctor's plan yourself and help them manage their visit. Or it's also great for parents who maybe one parent can come to the visit but the other one can't. And this way they can both hear that information and they can listen to it in their own space when they're more comfortable and can concentrate. So that's the biggest items here. I'll just quickly show you also that all of that same information that you had on the web is available right here from the mobile device, including that health summary that you saw, as well as the medical timeline is here, and you can filter that as well. So one of the great ideas is you can see there's always a share button in the upper right corner. So imagine that you're sitting on an exam table or you're in the emergency room and you need to share some information because they don't have it. You can send this straight over to their fax machine or electronically if they can take it. And then they have that information from anywhere in the world. You can do this. So that's really a great thing to be able to have this information at any time that you need it. So I'll wrap up the demo at this point, and I'd like you to check us out at caresync.com or in the Apple and Android store. Thank you. Have a great day.